Hi, thanks for tuning in. Today's tips are a really simple one, but a topical one. So we hear a lot about the daughter test, and I don't maybe you've heard of it before, but the daughter test generally is talking about an ethical test. How would you treat your patient? Treat your patient in the same way as you treat your daughter, or make the same decisions for your patient as you would for your daughter. And that seems obvious, and that's something we should all be doing to raise our standard. But what I want to talk about is the question that I get asked a lot is how to talk to patients about cosmetic dentistry, about whitening. And the concern we all have is we don't want to annoy people, embarrass people, come off as pushy salesmen. And what I'm going to suggest to you is a very simple thing. Apply the daughter test to communication as well as to ethics. So speak to your patients as if you were speaking to your family. If you were speaking to your daughter or your mother or your cousin, or whichever one applies to that particular patient in terms of age and sex, how would you talk about the color of their teeth and the possibilities around what's possible around the color of their teeth with your family? And then, unless you've got a very strange relationship with your family, it's unlikely that your patients will feel offended, embarrassed, or you'll come off as a pushy salesman, because you'll be talking to them in that way. While we're on the subject of the daughter test, if your family did want teeth whitening, which whitening system would you recommend to them? Have a think on that one. Thanks for tuning in.